If you're considering a career as a physical therapist, then the MedStar NRH network is just the place for you. Because here, physical therapy isn't just a profession, it's a passion.
I definitely have a passion about what I do. I do love it. You definitely feel easy and pain-free is the key.
Definitely pain-free. Very comfortable.
All right.
I always tell people, individuals bring 4 things to an interview. We bring what's in our head, we have a resume in our hand, we bring our heart, we bring our gut. I want to make sure we're hiring the people that have the right heart and the right gut.
MedStar NRH is your pathway to success for a variety of reasons. It offers enormous opportunity for growth.
I love the ground. That'll definitely change ground reaction forces.
Josh Billings knows that firsthand. Because of the MedStar NRH network, he's been given all the support, education, and tools he needs to create a world-class program from scratch.
We are the place for sports medicine. We basically share a clinic space with some of the sports medicine physicians here, and that's, Leanne Curl, the head orthopedist for the Ravens, and Milford Marchant, the head orthopedist for the Chesapeake Bayhawks Major League Lacrosse team. So, we're interacting with them every day. We build programs together with them. Our ACL program, running program has been part of that. So it really is a pretty ideal setup that we have here.
His facility in Baltimore provides highly specialized care using the most advanced treatment techniques and devices. The Alter G unit enables Billings and his team to help patients experiencing difficulty with weight bearing during walking and running to return to the activities they love much faster and more effectively than ever.
Yes, so by the end you're doing 31 miles a week.
Billings knows that as a therapist within the network, you'll have flexibility to create something special, to challenge yourself, to grow. In addition, you can move from a clinical setting like a hospital to working in an outpatient sports medicine clinic. This map illustrates another important part of the network. With more than 30 outpatient therapy sites in Washington, D.C., Maryland, and Northern Virginia, you'll have the chance to focus on any interest you like. You can work with occupational therapists, speech therapists, and physiatrists at selected sites, for example. You'll be part of a collaborative team sharing and exchanging information. As a therapist, you'll be a student for life. And as one of the country's leaders in rehabilitation, MedStar NRH is always striving to provide an environment of learning.
It starts with education. If you're coming in as a new graduate or someone with less experience, you can get a lot of experience very quickly from a lot of really talented people. There's a resource for just about everything you want to know more about or grow in your career, so you're not kind of out on an island or figuring out on yourself.
And so this learning, treating, teaching environment, I like to call the environment of learning, or the EOL. I feel that we in the MedStar NRH Rehabilitation Network have a tremendous opportunity to provide for our clinicians an environment of learning that is enriching and helps them become the best therapists that they can be. And in doing that, we can provide the best care for our patients.
This environment of learning allows you to come in as a student, gradually become a teacher, and eventually become a mentor.
So we spend a lot of time focusing on a mentorship program, making sure that each clinician knows how to access it. We even back it up with a formalized environment of learning database, where at all points in time, all of us can see how our mentees are moving along, providing them their guidance and their mentorship pathway, if you will. And it's our job to help move them along that pathway very effectively.
The environment of learning is augmented by the close collaboration with physicians. As a therapist in the network, you'll have an opportunity to learn from some of the best and brightest. Dr. Leanne Curl is the team doctor for the Baltimore Ravens. She also works closely with Josh and his team at the Harborview facility in Baltimore. She knows collaboration is a two-way street.
We share what we know, we share experiences, we share our fund of knowledge, and we collaborate and try to bring that to the top to get our patients better as quickly as we can.
I think it's better for the patient. I mean, I think it is educationally and professionally rewarding to be able to work with colleagues and to share knowledge or expertise on areas. So I think it is good for both the physician and the therapist. But I think the patient in the end is the one that wins.
We're part of a healthcare system, MedStar Health, which is 26,000 team members strong. We have some of the best physicians, not only in the Mid-Atlantic area, but in the country. With these physicians, we can shadow, watch surgical observations. We co-locate with them in many of our sites. We have 33 sites now. We're working on a few more now. And I like to call the sites where we co-locate with our physicians incubators. They're opportunities for us to work with those physicians, side by side, as peers, creating new approaches to care, creating new protocols, new programs, coming up with research study concepts which will help us demonstrate the efficacy of our new approaches to delivering services. And in this environment, this enriching environment, we want to make sure that our therapists are immersed. So they not only spend time in our network providing great care, but they spend time in our network learning how to create and provide better care.
Your career roadmap as a therapist is wide open. Some therapists have even gone on to become doctors, like Dr. Richard Hinton.
Yeah, I started out life as a physical therapist and an athletic trainer, and it's been a tremendous background for being an orthopedic surgeon. It's also given me the opportunity sort of throughout my career to really work with physical therapists and trainers and really trying to share the body of orthopedic sports medicine knowledge with them. NRH has really provided a very proactive environment for education for the therapists and the trainers in the system.
Demand for physical therapists is growing, occupying more than 185,000 jobs in the United States in 2008. It's expected to continue to spike even higher in coming years. Experts predict it will jump by another 30% through 2018.
You are getting better. Look at that. That shake's getting a lot better.
So it's a field that's growing, that offers you growth, and it's incredibly satisfying. A therapeutic setting is a powerful place to work. According to rankings in U.S. News and World Report, the Wall Street Journal, and CNN Money, physical therapy is consistently ranked at the top of professions for job satisfaction. John Brickley believes he knows what drives that satisfaction within this network.
What is that? And it's the intangibles. Of course, they have great clinical and technical skills, and it's our commitment to help all of our clinicians get to that place. But it goes far beyond that. It's really about being nice. It's truly about displaying empathy on a regular basis. It's about being committed to provide rapid, easy access to care. It's saying we don't believe in waiting lists. Patients need to be seen, period. They need us.
As baby boomers continue to age, healthcare will continue to grow, giving you as a therapist a wide range of options to focus your work in a number of interesting areas. You can work with patients who have brain injuries or are recovering from a stroke. You can focus on sports medicine or hand therapy, just to name a few of the specialty areas. Richard Carter is a Washington, D.C. police officer badly injured in a motorcycle accident. The hand therapy he received helped him to get back to work. There's no question in his mind about the importance of physical therapy and the benefits of this network.
A lot of my colleagues came to me and told me this is the best place to come. They treat you right.
So whether it's a parent who injured their back who has difficulty with childcare activities, or a young soccer player suffering from a weekend game injury, a grandparent with arthritis looking forward to playing once again with their grandchild, someone with jaw pain or facial palsy anticipating that Thanksgiving Day dinner, a cancer patient dealing with fatigue, or even a Division I collegiate level athlete anxious to get back to full form. Therapy is often a rewarding activity to help restore function.
Oh, it's wonderful. It's an attitude changing every day. It makes it a joy coming to work. For us, it's very rewarding.
MedStar NRH offers you a chance to learn, to share, and to challenge yourself and your patients. The network regularly has close to 400,000 outpatient visits each year. So being a physical therapist is a rewarding journey that can help you fulfill the MedStar NRH credo of adding life to years.